Hello and welcome to the EnterpriseTalk Conversation Series, a peer knowledge resource by the CXOs for the CXOs. Now to our host, Kanika Goswami.
Good evening, Christopher. For our listeners, we have Christopher Malter. He's the CEO of Avalon.ai, which is an artificial intelligence company at the forefront of digital transformation in primarily healthcare sector as on today. Christopher, how are you doing today?
Wonderful. How are you?
I'm good, thank you. Before we start with the questions, Christopher, it would be nice if you have a short introduction of yourself and of the organization that you are heading.
Sure. Happy to be here, and well wishes to everyone going through this very trying time from a worldwide perspective, meaning the pandemic. So, and I hope everyone is faring well. But thank you for having me. Christopher Malter, CEO of Avalon.ai. My background is healthcare and venture. So basically, 25, 30 years in healthcare and doing mostly focusing on early stage technologies in specific disease states, medical device companies, therapeutics, and doing some exits. Worked with actually partners with former Speaker Newt Gingrich in the United States, and we did a lot of turnarounds in highly expensive disease states like hemophilia, and so that's sort of my background. And then Avalon.ai, it is a company that is truly redefining healthcare outcomes. And I know that sounds grandiose, but it's really true. So right now there's a differential going on. There's a transition with AI, okay, and what it does. Right now with AI, especially in healthcare, it aggregates data. So you have EMR, platforms like Epic and Cerna, and they aggregate data, but they don't truly integrate AI at the point of care, which means that, they don't address prescribing habits. They don't address outcomes related to procedures for physicians, nurses, and address baseline metrics. We do. And we do this not only with one or two hospital systems, but hospital systems throughout the country. And so that's the differential. That's what Avalon.ai does. And we are primarily focusing on, the hospital healthcare industry at this juncture, but obviously we're going to be expanding as well. I hope that helps you. That's Avalon.ai.
Certainly, and thanks so much for that introduction, Christopher. So, what has, in your mind, been the impact of digital transformation on healthcare, especially at the time of the pandemic that is going on right now? How do you think digital transformation has been impacted and has created an impact on the enterprise during the pandemic?
Yeah, so great question. Basically, having been in healthcare for such a long time, healthcare, especially in the States, but it's always been the last bastion of manual workflow. They still use faxes. It's very, very digital technology has not truly been accepted in healthcare, whereas in other sectors like finance and others, and supply chain, digital transformation has occurred. So the pandemic has actually accelerated the maturation and the acceptance. That's what I've seen. It's just amazing, because I think what's happening is healthcare now has to be responsible for metrics and protocols and understanding the patient journey from the beginning to the end. Again, that's contact tracing, right? That's where we are, right? If you are diagnosed with COVID-19 prior to receiving healthcare services, then once you leave and you're discharged from a hospital system, for example, we need to track you. We need to understand that patient journey. So again, the acceptance is is significantly more rapid, faster.
Right. So it's accelerated the digital transformation for various reasons. And in what ways do you think the digital technology as one of the healthcare trends will change the healthcare industry and the patient experience in the coming years? So when I say the coming years, what I actually mean is now whatever is going to happen from this year or after the pandemic abates, when it abates, there we will be in a new normal. So how do you think things are going to change there? Given that digital technology has come to the forefront because of this pandemic?
Yeah, so I think two levels, right? One is you're empowering healthcare systems, hospital systems, to now reestablish baselines that were never addressed before. Again, going back to, for example, just for the easiest, let's just say opioids, right? Opioids, the standards of regimens, or in other words, the amount of opioids given for any procedure was truly never really addressed from the U.S. healthcare perspective. And now it has to be, and now it can be because of AI and the integration of AI at the point of care. So that is applicable on a worldwide basis as well. And then the patient experience, obviously, that will have a dramatic effect on the outcomes. Right. So, which means that, patients are in hospitals, their patient stay is less, their treatment protocols are different, they're better, there's less side effects. So those are some of the easiest ways that healthcare is going to change, or digital healthcare is going to change the delivery of care. It's going to be better.
So this was about digital transformation in today's times. Now we will come to specific artificial intelligence in healthcare. How do you see it as being the game changer in patient care now and going forward?
Yeah, so I think ultimately you're gonna have to address you're gonna change outcomes, right? So, and you're gonna understand the patient journey. So again, I'd like to give examples. So for example, when you're dispensing drugs in the US, when you're dispensing drugs or when drugs are made, you can actually track a pill from the manufacturing side all the way to the pharmacy. You cannot track the pill from once it's dispensed from the pharmacy to the patient. And so because of biometrics and because of our technology that embraces the patient journey following the dispensing of drugs, of medication, we now can truly embrace the patient journey further. And now the patient is engaged. We are receiving data on behalf of providers and hospital systems, and patients are receiving information based upon any kind of side effects they have, right? So if right now, for example, when physicians prescribe medication for specific disease states, could be cardiovascular, whatever it is, a lot of it is trial and error. It's so, okay, you're taking 50 milligrams, you're having side effects, that's not good, take 25. I'm going to lower your dosage. So now that's going to be faster and better because of the integration of AI in the entire delivery of healthcare for patients.
Right. Now, over the last few months, cybersecurity has come to the forefront as one of the topics of, major topics of discussion. Various reasons, remote working teams being the biggest of them, has encouraged a lot of cyber risks in the industry, across all industries. So is there a fear of security of data slowing down some of the health technology advancements? And is artificial intelligence also a part of that, that fear factor which is happening, and maybe, blocking innovations or the move ahead, the speed of evolution of the technology for healthcare? What do you think?
Yeah, so I think, look, I'm from the innovation side, but I also understand policy, right? So what does that mean? That means that government policy is put in place, especially like HIPAA rules and regulations to protect patient, confidentiality, and it's very effective. However, I think what has happened over the years is that sometimes government intervention becomes too sort of landlocked, and it stymies innovation. And so I think again, going back to the pandemic, what has happened is you have to move fast because the pandemic is basically affecting all of us, and it's taking a big toll, meaning death, rates, they're increasing, patient population admittance to hospital systems, right? So we have to move fast in order to deal with this pandemic. And so HIPAA rules and regulations and other government requirements are less important. And the funny thing is, I also think that it's I shouldn't say less important. There's a lack of knowledge. Technology today fully supports HIPAA rules and regulations and has done that for years and years. I think it's a knowledge gap based upon hospital systems and administrators and physicians who truly do not understand and know what AI and what technologies support HIPAA rules and regulations. They were always in place anyway. So I think ultimately innovation is now taking precedence, and they will always maintain HIPAA rules and regulations.
Yeah, but would you say cybersecurity of data is, when it is being used in artificial intelligence tools, as being at risk,
not
just like the rest of the environment?
Yeah, no, not at all. And so I think absolutely so most technology, in fact, all technology from a healthcare perspective, we must maintain the highest standards of cyber security and HIPAA rules and regulations. It's like they basically come one and the same. And so those requirements and advancements must be maintained. Data security is always an issue for us from an Avalon.ai perspective. We maintain the highest level of cybersecurity, and we prevent cybersecurity issues. And we have multiple protocols in place. So innovation will always be there as it relates to where we are today.
Right. So you do not perceive any threat coming in from any direction. So and in the new normal, in this year and the next, or I think it'll be more pragmatic to say when the pandemic abates, what technology trends would you put on the top, especially for healthcare? And what would be, in your view, the most sought after technology solutions for this sector once we are in a slightly more normal position than we are now? How do you see it panning out?
So I see it kind of twofold. The easiest is from a healthcare perspective, you're going to see a higher acceptance of AI integration, not only from an aggregated perspective. So, I remember 15, 20 years ago when healthcare was reluctant upon accepting EMRs like, the Epics of the world and the Cerners of the world. But today they're there, right? So, and hospital systems utilize and integrate EMRs. It's almost ubiquitous now. So that's done. I think what you're going to see from a hospital perspective, you're going to see more and more the integration of AI at the point of care, right? And that's really where you're going to really redefine standards of care and outcomes. And we feel, Avalon.ai, we feel that we're positioned well for that. The other side, which I think is, really cool, I think that you're going to have a transference of ownership in healthcare to the patient. which means ultimately that, today we still rely upon providers, physicians, hospital systems to offer us the latest treatment protocols for whatever is ailing us. If it's, cancer, earaches, flu, whatever it is. I think what I see is that you're going to have more of a bigger ownership from a user or a patient perspective in their own healthcare. And that's going to be the integration of healthcare or IT and AI in apps and technologies that they will have access to.
Right. And because of this widespread pandemic, Christopher, do you see this as a kind of a turning point into the adoption of point of care technology, and that providers will be open to adopting other new technology innovations, whether or not they're driven by artificial intelligence? How do you feel?
I do. I actually think, again, I do believe that it's going to switch. And what I mean by that is I do believe that ultimately what's going to happen is you're going to have the average user or patient will have full access to his or her medical records, and with the integration of genomics and AI, you're going to have a very sniper approach to treatment protocols. So, again, I'm kind of aging myself here, but if you go back to like the 70s when it was in the 80s, when it became very, very popular for people to integrate fitness protocols into their workflow, right? Go to the gym, work out, right? Take ownership of their own healthcare. The same is going to apply from a technology perspective. So there's more and more apps where people can use. They can, for weight loss, and then for other elements, it can be much more comprehensive as it relates to, Christopher Malter and my DNA, right? So, I hope I'm conveying this the right way, but ultimately, you're going to have your own treatment protocol based upon your genomic makeup, and that's good. You're going to have access to that from a very, very early age, and you're also going to get suggestions based upon treatment outcomes. So if you're healthy, fine. If you're if you have an ailment, then here are the treatment protocols and outcomes that are going to be provided to you based upon AI and new technologies, and not that coincide directly with your physician without seeing your physician.
Right. And one slightly aligned question to this, but it just popped into my mind. What if the pandemic hadn't happened? How long would you think it would have taken to reach the same levels of point of care technology adoption? Do you think it would be at this fast, or do you think it would be faster or slower?
Yeah,
how would it be?
So it's much slower. It's much slower. There was no need to make it. There was no need for anybody to pivot. I associate this with, in the U.S., basically what happens is traffic lights are usually put up after 4 or 5 traffic accidents that either cause major damage, hospitalizations, or death. And so it's a completely reactive approach, unfortunately. And so the same applies to our healthcare system. Our healthcare system has been completely reactive, and now they have to be proactive, and the onus is on them to move very, very, very quickly. While maintaining the rules and regulations that are in place and ensuring cybersecurity protocols are in place, which as for Avalon.ai, we do this. But right now it is absolutely crucial at hospital systems, physicians, nurses, all providers truly embrace the patient journey from the beginning all the way to the end. And our technology can do that. So I think that's, sort of where we are today and where we are going. So it is happening. It is truly accelerating the maturation much, much faster.
So that may be one of the good points, if any, at all, of the pandemic hitting humanity with so much of force. Thank you so much, Christopher, for your time. We are about 20 minutes. I think it's a good conversation we had, unless you have something to add.
No, thank you for having me. I appreciate the opportunity to share these thoughts and ideas, in the future of healthcare and the integration of, digital transformation in healthcare. So happy to do that.
Thank you. Thank you so much, Christopher, for your time.
Thank you so much for being with us. Please do follow us on social media for regular updates and new content.